Hi, my name's Noah. I'm a athletic trainer with Towson Sports Medicine and physician extender at Towson Orthopedic Associates. Today we're going to be talking about hamstring strains. So when we're talking about the hamstrings, there's a bunch of muscles in the back of the thigh that are kind of in the hamstring region, but we're typically talking specifically about the biceps femoris, the semimembranosus, and the semitendinosus. So the hamstrings are the main group of muscles that are responsible for mainly flexing the knee, but they also kind of help extend the hip as well. So thinking when we're running or when we're going up and down the stairs, those are your hamstrings that are activating to drive your heel down and back. The hamstrings are also one of the most commonly injured muscles in especially the thigh. So we don't typically think of a lot of quad injuries, especially in athletes. We're thinking of a lot of hamstring injuries. So those Charlie horses, hamstring strains, hamstring avulsions when you're running, playing football, tennis, lacrosse, soccer, all of those are really hamstring intensive. And a lot of people are also super tight in their hamstrings, so it's a little bit easier to injure when you're really tight. So what does a hamstring strain look like? So when we think of a hamstring strain, we're typically thinking of some pretty classic signs: pain, decreased range of motion. So it's gonna get really painful and difficult to fully extend the knee or to do like a sit and reach kind of stretch. But for really more serious hamstring injuries, we're thinking of maybe a large bruise in the back of the leg, tenderness in an area where you felt a pop, pain up at the gluteal attachment, so where the hamstrings attach below the knee all the way up to your sit bone, your ischium. Sometimes you can have a lot of tenderness up in that region. And then for really significant injuries, you might have a deformity, so we can feel kind of a little divot in the hamstring. So there's a few common causes of hamstring injuries. Like I mentioned earlier, the main one is typically being super tight and having a very active lifestyle. So if you're engaging in sports, especially without an appropriate warm-up, you're probably gonna be at a higher risk of straining that hamstring. So what do we do to treat a hamstring injury? Pretty straightforward, but unfortunately it just takes time. These muscle injuries can often kind of lag and linger, so we typically just wait for them to sort of start to get better on their own, maybe incorporate a little bit of physical therapy with some stretching, some foam rolling, a little bit of massage, potentially some cupping, and then some rehabilitation exercises. But hamstring injuries can often take weeks, or in older adults, months, to fully return back to a previous normal. So what can we do to prevent hamstring injuries? There's a few things. The main thing that we typically recommend is, like I mentioned earlier, getting a nice quality warm-up in. So not necessarily relaxing the hamstring, but making sure that we're getting some blood pumping, feeling that stretch and contraction a little bit more, and then getting a better neuromuscular response from the hamstring when we're doing activity. So getting it to fire appropriately and quickly without having too many injuries. Making sure that we're training, so we're keeping that hamstring strong and long. So longer stretching routine, a consistent stretching routine, and keeping it nice and strong will keep it more elastic and less prone to injury. So it's got a little bit more stretch and a little bit more give, so it's less likely to actually be injured. So what are the signs and symptoms of a hamstring injury? So for a hamstring strain, there's a few classic things that we typically think of. You're probably gonna think of those Charlie horse symptoms, right? Like tender to palpate, it's gonna be kind of tight on a sit and reach type stretch. For more serious hamstring injuries, a higher grade or grade 2 or 3, we might get a more classic, in our field, deformity. So you're gonna feel kind of a little divot where the fibers have torn. You're gonna get a larger bruise, even more decreased range of motion, especially if you have pain up at the ischium, your kind of sit bone, where the hamstring attaches up at the top. That's a very common place for the hamstrings to tear. And so having pain with sitting and pain with pushing up in those sit bone area is a pretty classic indication that we've got some kind of injury to the hamstrings. So for a supine hamstring stretch, I'm gonna get a stretching strap, a belt, anything that you have. I'm gonna lie flat and then pull my foot up into the air, and I'm looking more for a good stretch in the back of my thigh more than I am a perfectly straight knee. So it's okay if this is bent a little bit, as long as I'm getting that nice deep stretch. I'm gonna hold this 2 to 3 times for at least 30 seconds. So next, for a contract, relax, stretch, I'm gonna grab a chair, a step or stool, something like this, about 1.5 feet or so up off the ground. I'm gonna start by pushing my heel on top of the chair and then thinking about driving down and holding that nice strong contraction for about 10 seconds, feeling that in the back of my thigh or the back of my hamstring. After that 10-second hold, I'm gonna relax, get that nice deep stretch, and reach with the opposite side hand for about 30 seconds. I'm gonna do this 5 times. Next is gonna be a quad stretch. I'm gonna lean up against a wall or railing here, just in case I need it. First, I'm gonna think about pulling my knee back behind my hip and then holding my heel to my glute. From here, I'm gonna think about squeezing my abs and feeling a slight tilt in my pelvis, so I get a nice stretch all the way from the top of my hip down to the front of my knee. I'm gonna hold this 2 to 3 times for about 30 seconds, both times. Next is gonna be divers. So this is kind of like an RDL. I'm gonna be with my injured hamstring down, and I'm gonna think about pushing up with my back leg and reaching forward with my opposite side, same side that's up, arm. Thinking about pushing my back heel down and back. I'm gonna pause for just a couple seconds at the top, and we're gonna do 3 sets of 6. Next, we're gonna do short arc knee extensions. I'm gonna start by finding a table or a bed, some flat surface I can do the exercise on. A yoga mat on the floor works just as well. I'm gonna go ahead and lie down. I'm gonna start by grabbing the involved knee behind my knee, extend so I feel that nice stretch along the back of my hamstring, hold for about 3 seconds, and then relax back to that starting position. I'm gonna do 3 sets of 12 of these. Next up is gonna be hip extensions. I'm gonna get a band, TheraBand, right around, just below my knees, around the bulk of my calf. I'm gonna be injured leg up and push straight back, nice and slow back down. Again, pushing up and back, so I'm feeling a small contraction in my hamstrings. My glutes are a little bit involved, and then nice and slow back to that starting position. For this exercise, we're gonna do 3 sets of 10. This exercise is gonna be pelvic lifts, very similar to glute bridges, but we're gonna be focusing more on the hamstring as opposed to the glutes. Again, I'm gonna be on my table. If you have access to it, the floor works just as well. I'm gonna go ahead and lie flat down on my back, picking up my toes, and then thinking about putting my heels down and towards me. I'm gonna lift my heels up, feeling that nice tight contraction in my hamstrings, and then very slowly lower down, thinking about pulling my heels towards me. For this exercise, I'm gonna do 3 sets of 12. Next is gonna be prone hamstring curls. So if I have an ankle cuff weight or something like that at home, that's great. I'm gonna go ahead and put that on. I can either be on the ground, maybe on something comfortable, on a table surface like this if you have it available to you. I'm gonna go ahead and lie down. I'm gonna start by driving my heel up and back towards my glute. Nice strong contraction at the top, and then very slowly lowering back down, taking about 3 or so seconds to come back down to that starting position. For this exercise, I'm gonna do 3 sets of 12. This exercise is banded knee flexion, so I'm gonna grab that TheraBand from earlier, very similar to the prone hamstring curls. I'm gonna take these and wrap my band around both ankles. From here, I'm gonna go ahead and lie down on the table with the band around my ankles. And this one is gonna feel a little bit different from the prone hamstring curls. So again, I'm gonna think about driving my heel up and back, but I'm gonna be limited in a different way than I was with the ankle cuff weights. For this exercise, I'm gonna do 3 sets of 10. Next is gonna be some step ups. I'm gonna grab a stool step or a set of stairs. I'm gonna have my injured hamstring up on the step, going up to the side. I'm gonna pop up and then nice and slow down into the floor. Again, for this exercise, we're gonna be doing 3 sets of 10.
Like and subscribe for more physical therapy and sports medicine tips. Please visit TowsonSportsMedicine.com to learn more about our 7 locations and comprehensive services.